Do you feel safe right now? If you do, why is that? Is it because you're at home where you know your surroundings? Is it because you're in a school that may have security guards? Is it because you're young and healthy and thankfully have no diseases to worry about? There are plenty of things that can influence each person's safety. Some are individual in nature, and others are environmental, socioeconomic, or cultural. Why don't we take a look at some of them? You as an individual have certain qualities and attributes that may make you feel more or less safe. For instance, if you are over the age of 80, you may not feel as safe as much as younger people being at home alone. At that age, it's far more likely you're going to fall down the stairs and perhaps hurt yourself. This is why companies sell bracelets and necklaces that have buttons that can be pushed to go get help in case you can't get to the phone. Actually, in the example I just gave you, your environment also influences your safety. For an elderly individual, even their own home environment may pose serious danger. For others, their environmental dangers may tie in with where they work. If you work in an office, the dangers to your safety are minimal, but if you work in construction, then your job can pose many personal safety risks like falling objects or getting run over by some big machine. Socioeconomic factors are a big determinant of personal safety. If you are quite poor and live in high crime areas, chances are far higher you're going to be hurt or killed than if you are living in a privileged gated community with 24-hour security patrols in the neighborhood. Even if you aren't involved in criminal activity, you might get hit by a stray bullet or be mistaken for a criminal. Cultural factors are also at play with respect to personal safety. If you are in a foreign country and can't speak that country's language, you might miss important warnings, or you might completely accidentally do or say something that is totally okay in your home and culture, but is a punishable offense in another nation. For instance, in the US, you can criticize the country's leaders all you want. In Thailand, criticizing the king is a punishable offense. Other factors that may influence your safety tie in with the first factor I went over, individual factors, except these are a bit more nuanced. For instance, a person's medical concerns can most definitely influence their personal safety. I remember one time passing through a foreign nation and having to, unfortunately, go to the hospital there. There sat a girl who couldn't speak any language anyone else spoke in the hospital. I eventually was able to, quote, talk to her thanks to Google Translate. It turns out she was visiting this country on vacation all alone. She had lost consciousness on the street that night because she was a diabetic and ran out of insulin and was unable to communicate her way around the country to get more insulin prior to that. Imagine that. Thousands of miles away from home, and you have a medical emergency like that. That's pretty scary. Related to medical concerns are, of course, psychological concerns. If someone is prone to a lot of stress, anxiety, or has a mental disease, they may say or do things that put them at great risk of harm to themselves, even if they don't really mean it. This is doubly true if they are not using their medication as instructed by their doctor. A person's safety is influenced by a lot of different factors, including individual factors like their age, the environment, such as their work environment, socioeconomic things like the kind of neighborhood they can afford to live in, cultural factors such as their language, medical issues, and psychological concerns.
Take a quick glance at your surroundings right now. Go ahead. I'll wait. How safe are you at this moment? Depending on where you are and what is around you, you may feel safe or you may not feel so safe. If there are any hazards or anything that poses a threat to a person or property, you may not be feeling so safe. Now, how often do you assess your surroundings for potential hazards? Do you assess potential hazards when you're at work, or do you automatically assume you are safe? When you're working as a nurse, identifying potential hazards while at work can be the difference between going home safely each night and being injured and ending up as a patient in a hospital where you work. Identifying hazards in your work environment may be new to you, so you may need a little help. Jackson is a nurse and OSHA officer, and he is going to help us identify some of these hazards before they have a chance to cause harm. Jackson immediately sees a physical hazard as soon as he walks in the hospital. A physical hazard is any physical thing that may cause harm to the body. The quickly identified physical hazard that Jackson sees is the floor. Most hospital floors are slick and pose a fall risk. This risk is enhanced if the floor is wet for any reason. Hospital floors may be wet from being cleaned, spills, or having various bodily fluids from patients on it. For this reason, nurses wear shoes that are slip resistant. Another physical hazard appears to Jackson as he continues walking down the first floor hallway. He sees the supply closets where boxes, equipment, and materials are stacked from the floor to the ceiling. This is a hazard because the items that are stacked up higher could potentially fall on the worker's head either by itself or while the worker is trying to get items down for use. It would be safer to keep items stacked only about waist or shoulder height. If things are stacked to the ceiling, then a stable ladder or step stool should be available to assist with getting items down. There should also be another person available to assist with keeping the ladder steady and getting the items down. These steps will help to decrease the likelihood of something falling on a person's head or the person losing their balance on the ladder while holding boxes or equipment. The other physical hazard that this supply closet poses is potential injury from lifting the various supplies in the closet. Lifting heavy boxes and equipment can cause injury if they are not lifted using the correct body mechanics. Jackson has witnessed this hazard before when a fellow nurse injured her back by lifting heavy boxes to put them in the supply closet. So Jackson is very aware of this danger. Jackson has been interrupted from identifying hazards because a coworker has just requested that he help her with moving a few patients. Moving patients is another physical hazard that comes along with being a nurse. You will more than likely have patients that are either immobile or need assistance with moving. The hazard here is mainly to your back. You can strain the muscles in your back and injure yourself if you do not use the proper body mechanics when moving patients. Now that Jackson has finished helping the other nurse avoid a hazard that she was faced with, he is back on his task of identifying other hazards in the work environment. He is coming to the hallway with a lot of different medical and microbiology labs. There are many chemicals used for chemotherapy treatments and other chemicals used for running lab tests. Most of these chemicals are hazardous to him if he comes in contact with them without the proper protective equipment. As Jackson surveys the lab from the doorway, he notices that all the lab workers have on goggles, gowns, gloves, and face masks in order to decrease exposure to the chemicals. This is a great way to handle this particular physical hazard. The lab workers must work with the chemicals, so avoiding them is not a possibility. The only thing they can do is protect themselves from the chemical hazard. There is a specialized group of physical hazards which are the mechanical hazards. These are machines and other movable devices that may cause harm to the body. Let's get back to Jackson as he begins looking for the mechanical hazards in his hospital now. From the lab, Jackson is able to see the room where they sterilize lab equipment, surgical instruments, and some other reusable items. The autoclave is the main sterilization machine used in this room. There are many of them, and they work by creating steam under pressure at very high temperatures. It would be very easy for him, the lab workers, or other nurses to burn themselves on the machines or equipment and supplies coming out of the machines. Speaking of lab equipment, Jackson has just remembered that they pose a hazard even when they are not hot from being sterilized. The equipment could be contaminated with bacteria, viruses, or other microorganisms that can cause diseases. Some of them operate at high temperatures and could burn him. Other lab equipment is sharp and may potentially cause lacerations in Jackson's skin. He recalls learning the best tool for addressing these hazards is to be aware that they exist. The last area of this hallway contains the patient testing and treatment labs. The biggest hazard Jackson sees in these labs are the sharps. What does Jackson mean by sharps? He is referring to the needles, syringes, lancets, and other sharp items used for blood withdrawal, injections, and minor treatments. The last thing Jackson or any other nurse wants to do is get stuck by one of these sharp objects, especially after it's been used on a patient or has anything in or on it. This hazard goes beyond just potentially being painful if he gets stuck. He could become contaminated with the patient's blood or be accidentally injected with drugs and/or infectious agents. Since this is one of the biggest hazards that nurses and other healthcare workers face, there are many rules and guidelines in place to address this hazard. The main thing that Jackson and his fellow nurses need to remember is to never recap a needle and always dispose of sharp objects in the designated sharp containers. There is quite a bit to be careful around in the healthcare workplace. We discussed that hazards are anything that pose a threat to a person or property. Two different categories of hazards are covered in this lesson. The first category of hazard is physical hazard, which is anything physical that may cause harm to the body. There are several examples of physical hazards that exist in the healthcare setting, such as slippery floors, boxes stacked above the head, and assisting patients with movement. The second category of hazards is mechanical hazards, which are machines and other movable devices that may cause harm to the body. Some mechanical hazards may include machines, contaminated supplies, and sharp objects.
When Jane's father died, she was more than happy to have her mother move in with her. However, as the years passed, her mother grew increasingly weak and unsteady. She also noticed that her mother would become confused and forgetful in the evenings. One night, Jane woke up to find her mother had gotten out of bed and fallen in her bathroom. Jane worried about her mother's safety and felt she could no longer sufficiently care for her mother in her home. But would a nursing home be a safer solution? In this lesson, we'll follow Jane as she consults with a representative of a nursing home. You'll learn about devices used in nursing that promote patient safety. Jane visited Restful Pines Nursing Home to meet with Sue, who was the representative that would show Jane around the facility. Sue assured Jane that creating an environment that was safe for the patients was a high priority for the Restful Pines staff. She mentioned that, like Jane's mother, many of the nursing home residents had a desire to continue walking, but were growing increasingly unsteady. To help Jane's mother, Sue discussed the use of a mobility aid, such as a cane, which is an assistance device with a single handle, or walker, which is an assistance device with 4 widely placed legs or wheels. Canes, walkers, and other mobility devices allow patients to continue independent mobility with less fear of a fall. They are also used to prevent physical weakening and help patients avoid pressure ulcers that can develop when a patient spends long hours in a seat or bed. Sue went on to explain that Jane's mother would be fitted for the right mobility device. For instance, walkers come in different heights to match the height of the user. She also mentioned that Jane's mother would be introduced to a physical or occupational therapist who could train her in how to properly use a mobility device. Jane felt this was a good way for her mother to remain safe while walking, but she did have a concern. Jane mentioned to Sue that her mother was growing increasingly forgetful and confused. After hearing a story about how Jane's mother had gotten out of bed and fallen, Sue asked Jane to walk with her into one of the residents' bedrooms so she could show her another device used to promote safety. In the bedroom, Jane learned about bed rails, which are board-like devices that run the length of the bed that can be raised and lowered. Sue shared some of the benefits of bed rails, including a feeling of security, a reduced risk of falling out of bed, and an aid for turning while in bed. However, she noted that Jane's mother would need to be evaluated to determine if bed rails were right for her due to the potential risks of bed rail use. These risks include injuries from trying to crawl over the rail, a feeling of isolation, and even strangulation or suffocation due to being caught between the rails. Sue could tell that Jane was feeling a bit unsure about how her mother would feel about bed rails. While Jane saw how they could prevent her mother from having another late-night fall, she worried about how her mother would feel about the loss of free movement. Jane asked about other restraints that might be used at Restful Pines. Sue explained that restraints were devices used to restrict movement in a patient. She explained that there are many different types of restraints, such as belts, that help a patient remain in a bed or chair. Extremity restraints that go around a patient's wrists or ankles to reduce the risk of falling out of bed and prevent the patient from pulling out therapeutic devices, and mitten restraints that go over the hands and prevent patients from dislodging medical equipment or scratching themselves. Sue explained that restraints were typically a last option and that their use was only permitted under the direction of a doctor. If a restraint was used, its use was monitored closely to detect any changes in a patient's skin integrity, circulation, or breathing. Jane felt better after taking the tour of the nursing home and talking with Sue. She felt that the devices she learned about would help the nurses take good care of her mother and provide her with the safe, comfortable environment she deserved. Let's review. In this lesson, you learned about a cane, which is an assistance device with a single handle, and a walker, which is an assistance device with 4 widely placed legs or wheels. These mobility devices allow patients to continue independent mobility with less fear of a fall. You also learned about bed rails, which are board-like devices that run the length of the bed that can be raised and lowered. Bed rails can provide patients with a feeling of security, a reduced risk of falling out of bed, and an aid for turning while in bed. However, there are risks associated with bed rails, including injuries from trying to crawl over the rail, a feeling of isolation, and even strangulation or suffocation due to being caught between the rails. Restraints are devices used to restrict movement in a patient. Examples include belts, extremity restraints, and mitten restraints. Restraints are only permitted under the direction of a doctor and require close patient monitoring.